one factor that can mitigate the effects of stress on our body is our personality. We can have a personality that makes us more or less stress hardy. So you might ask yourself, are you a type A person or a type B person? Where a type A person is competitive, hard driving, impatient, and of course, more likely to have a heart attack. But the one component of the type A personality that seems most important in terms of our risk of heart disease is expressed angry hostility, which is, getting red in the face, throwing a fit, the anger associated with having a very aggressive and reactive temperament. So the type A person seems more combat ready. They're more ready to fight. And of course, if you're ready to fight, you're having your fight or flight system activated in your body, and you're taking energy away from other body systems that keep you healthy. So in a 9-year study mentioned in your book, of 3,000 men, 257 of them suffered heart attacks, and 69% of those 257 who had heart attacks were type A. And not one of the pure type Bs, the relaxed and go with the flow folks, suffered a heart attack. We know additionally that pessimism is a personality factor which affects our risk of heart disease. When other factors like smoking have been ruled out, pessimists were more than twice as likely to develop heart disease. Suppressing negative emotions seems to increase our risk of heart disease as well. So, and even just having a broad smile correlates with health. In the study of the Major League Baseball players' photographs in your book, 150 of them who had appeared in the 1952 Baseball Register, those who were not smiling died about 7 years earlier than those who had a broad smile. And in general, men who were more pessimistic in other studies were more likely to develop heart disease over a 10-year period than optimists. So in the extreme example of pessimism, depression is equally correlated with heart disease. And depression and excessive inflammation in the body seem to go together. So you may have seen in the media when they're advertising drugs for depression, they're also talking about pain that individuals have in their bodies and in their joints. And it may be that this third factor of inflammation in the body is correlated with risk of depression and heart disease, as well as that chronic ongoing pain. So stress can trigger persistent inflammation, which is then reflected in depression and heart disease, as well as that chronic pain. So that people with high scores for depression in the years following a heart attack are actually 4 times more likely than their low scoring counterparts to have further heart problems.